And here in the maxilla, this is compact bone. You may see little perforations here, but that's where some blood vessels and nerves come out of little foramina. It's still compact bone. So if I showed you how a company, they actually drilled away the compact bone, and you can actually see where all that, you can see the spongy supporting alveolar bone internally. So here's where the alveolar process would end roughly, and you can see that's all spongy bone in the middle, covered by compact bone on the buccal and then not shown on the lingual. Just going back to your diagram, let's just use this one again. The basal bone, none of the details of the basal bone are represented, but with basal bone, you just have spongy bone in the middle and compact bone on the outside. So if I look at the compact bone wasn't cut away where the basal bone is, but I want you to understand that just going down in basal bone, you have the general organization of bone, spongy in the middle and compact on the outside. With the alveolar process, you have teeth there. So you have a tooth socket formed by the alveolar bone proper, and then you have the normal arrangement, spongy bone and followed by compact bone. Okay. Let's look at some additional terms that are going to apply to alveolar bone proper. As already defined, it's a thin plate of compact bone that forms or lines the tooth socket. This is actually looking at the tooth socket from a superior view. The tooth has been extracted, and I'm looking into the tooth socket here. All of this inside here is the tooth socket. So this is showing you the alveolar bone proper. Does anybody know what the term is for a tooth socket? It's on your, it's called an alveolus. Okay, a tooth socket is called an alveolus. So we can also say alveolar bone proper forms or lines each alveolus. The plural for tooth socket or tooth sockets is alveoli. So if on a quiz I asked you, what is this? You would be correct in saying that it's an alveolus, or you would be correct in saying that it's alveolar bone proper. But if I specifically asked you the type of alveolar bone shown, then the correct answer is alveolar bone proper. Okay. If you go to page 5 of your outline, I just wanted you to see that from a buccal view, I can also see, look how this is compact bone right here on number 19. I can't see it as well on the distal of the distal root, but this is, see how that's eggshell thin compact bone. So this is actually, I'm not doing this very well, sorry. So that's just another view of the alveolar bone proper. I think you can see how thin that is. I'm just drawing the width of it right there. That's all the alveolar bone proper that I can see really clearly on this mesial of the mesial root of number 19. Okay, but going back now to the second page of the outline, or I should say the second and third page, we're going to be looking at this diagram again, and then the diagram at the top of page 3. Another name for alveolar bone proper is what's called the cribriform plate. Okay, so we call the alveolar bone proper lining the tooth socket a cribriform plate because it's a plate of bone, of compact bone, with little perforations in it. Now, don't confuse this with marrow spaces, but there's these little, I guess maybe I should draw these smaller, little perforations. If you notice, there's these real tiny little holes here. Those are little openings for the blood vessels and nerves that go into the periodontal ligament. So a cribriform plate is a solid plate of bone with perforations. That's just what the term cribriform plate means. And it refers to the gross appearance of the alveolar bone proper. In other words, what does it look like with the naked eye? Remember from A&P, there's also a cribriform plate of the ethmoid bone that makes up the roof of your nasal cavity, and blood vessels and nerves come through that plate to innervate the nasal area. In this case, the cribriform plate applies to alveolar bone proper. In the lower picture, I want you to see that if I were to, I'm just drawing blood vessels that travel through the bone, and they come through these little perforations. Notice this diagram has little interruptions in the alveolar bone proper. That's those little pinpoint holes for the blood vessels to enter the PDL, or for nerves too. But I've just shown the blood vessels. And the next picture that's up under cribriform plate, it shows you with the naked eye, you can really discriminate compact bone with perforations from spongy bone with marrow spaces. Right. Do you need me to wait a few seconds? Okay, look at this picture. A represents the alveolar bone proper, or I can say it represents the cribriform plate. You can look at how what they did was the compact bone on the outside was removed, the tooth root, the tooth was removed, and what you're seeing is the back wall of the tooth socket. And you can see that that's dense solid bone, but it has little perforations, just like you could see from this superior or occlusal view of the tooth socket. In contrast, letter B, again, the compact bone covering this has been removed, and what's exposed is the internally where you see the spongy bone. And this, you can clearly see the spicules of bone forming that lattice work, and all these dark spaces represent the marrow spaces. This is a really good picture to distinguish the two. And again, I just want to reiterate with this picture, if I were to show this on a test, this is not spongy bone. These are pinpoint openings, not larger marrow spaces. Okay, when we look at an X-ray, alveolar bone proper is called the lamina dura. That Latin word dura means hard, so this translates as a little hard layer. And when I look on the radiograph, remember that the PDL space is the dark space surrounding the root, and then here's the tooth root, and as I move away from the root, I'm going to see the periodontal ligament, and then I'm going to see this dense, this compact bone, that white line. It's just the white line. Sorry, I just don't have a good mouse pad where I am, so it goes a little crazy. Okay, just the white line surrounding the PDL space is the black lines surrounding the outline of the root. The white outline is the lamina dura. So it appears as a thin white line, or a term for something that the X-ray doesn't penetrate is called radiopeg. Notice on the X-ray too, all the spongy bone you can see. You see the trabeculae, and the black holes are the marrow spaces. In certain pathologic conditions, we're going to see loss of definition of the lamina dura. Okay, finally, a microscopic term for alveolar bone proper is bundle bone. And before I define that, I want you to look at this picture. And like I said, all that which is bracketed is the alveolar bone proper. Alveolar bone proper is compact bone. And I want you to understand that microscopically, it has longitudinal lamellae that are next to the PDL. The LL stands for the longitudinal lamellae. So right in here has the longitudinal lamellae. And then as I go deeper in there, those are where the concentric lamellae are. Notice there's some blood vessels deeper right here. So this part of alveolar bone proper has its own blood supply. The part where the longitudinal lamellae are have to rely on the PDL blood vessels for its nourishment. Okay, but focusing on why is alveolar bone proper called bundle bone? What bundles of fibers are embedded in the cementum on one side and the PDL on the other side? It's those Sharpie's fibers. So they're actually embedded in where you see these little striations here in the longitudinal lamellae. Those represent the bundles of Sharpie's fibers. So under the microscope, alveolar bone proper is referred to as bundle bone. Sharpie's fibers also are embedded on the cementum side as well. Okay, so to summarize, alveolar bone proper is compact bone. It's very thin, like an eggshell, but it has little perforations in it for blood vessels and nerves to enter the PDL area. So it can also be called a cribriform plate because of its gross appearance. On an X-ray, it's referred to as lamina dura, and under the microscope, it can also be referred to as bundle bone. So it has different names depending upon the context in which it's used. Okay, and then this picture, I just wanted to use it as an exercise. I'm flipping the tooth upside down. Here's the tooth root, and then there's the periodontal ligament. And then remember, as I go away from the tooth root, I'm first going to have alveolar bone proper right in here. Then notice it turns to spongy supporting bone, and then on the outside here, it's back to compact. So if I actually look at a microscopic slide of a tooth, here's the root of the tooth, where I'm shading it in blue there's your periodontal ligament. And then if I just follow that thin area of compact bone, that's the alveolar bone proper there. In the middle here, I can see this is all spongy bone. The spicules of bone separated by marrow spaces. And then back out here on the buccal aspect, or the lingual aspect, here I'm back to the compact bone. Now notice on this slide up here, it doesn't look like there's much spongy bone near the alveolar crest there. Sometimes that happens. There's very little spongy bone in there. So it's like the alveolar bone proper and the compact bone supporting alveolar bone are fused together. Okay, this is a tooth root in cross section. And again, I can see as I move away from the PDL, I can see the alveolar bone proper. Here's that dense, thin plate of bone, and I can see Sharpie's fibers inserting into that. Another thing that this shows is here's a little perforation or opening for the blood vessels and nerves to come into the periodontal ligament area. Outside here, here's my, then I move away from that thin plate. Here's my spongy supporting alveolar bone, and then not shown would be the compact out here. So again, you can't get it wrong on the diagram or a microscopic slide. If you look for the tooth root first and the PDL, and like I said, is right next to the PDL and tooth root is going to be the tooth socket, the alveolar bone proper. And as you move away, spongy supporting alveolar bone, and then compact supporting alveolar bone. Okay, let's go to the alveolar crest. And I didn't repeat these pictures again. I do have some actual pictures of the jaws there, but just remember the most coronal boundary on this buccal lingual view or this mesial distal view, the highest point of the alveolar bone is the alveolar crest. So it's that most coronal boundary of the alveolar bone. And its position and its shape, you're going to be applying this to your assessment of x-rays, as you'll soon see here. Another thing I want you to understand is that the alveolar crest is also referred to as the crestal bone. And in periodontal disease, this is the bone that's first lost is that crestal bone. Okay, so on these diagrams, we can actually outline the alveolar crest. You can just go all the way around on the maxilla or on this mandible. There's the alveolar crest. And again, this is where its height and its contour is going to be critical to the accurate assessment of radiographs. You're not going to be looking at it like this on patients. You're going to be looking at radiographs. Okay, before we apply that, let's clearly define two other areas pertaining to the alveolar bone. And they are the interdental septum and the interradicular septum. Just recall the interdental septum is located in between the teeth. Inter means between, and dental refers to teeth, so it's the alveolar bone that's located in between the teeth. So if I go from the crest all the way down just past the apex, all of this is the interdental septum. So the definition is alveolar bone located between two adjacent teeth. And as noted on your outline, it's composed of mostly a lot of spongy bone. And again, this illustrator did not make all the marrow spaces go down. It doesn't actually end right there and become compact bone. Now, all of this is spongy right there. And then I just want you to see that on either side, its mesial and distal boundaries are alveolar bone proper. So if I just go like this and outline this side of this tooth socket, and then this side of the adjacent tooth socket, that represents the alveolar bone proper. And then what's been cut away is you just have to picture covering all of this is compact bone on the facial, and then behind the slide on the lingual. When we look at this on an actual maxilla or mandible, we can see that it's just between these two premolars, 4 and 5, I've outlined this would be the interdental septum. And it does show you that it, on the outside, it is compact bone. Or between number 29 and 30 here, this would be the interdental septum of bone in between the teeth. Again, that's just to show you that on the outside, that on the buccal or the lingual, it is made up of compact supporting alveolar bone. This picture, again, you have a close-up of it on page 5. I just want you to see that if I identify it at a lower depth, and then here at this is all the interdental septum. And what I want you to see here is see how when the compact bone on the outside's been cut away, that's all the spongy bone you see. And then you can also see the alveolar bone proper on the distal aspect of that root, and we can see the alveolar bone proper on the mesial aspect of the mesial root of number 19. And then if you notice, here's a radiograph, you should be able to identify the interdental septum. Here's one, and here's another shown. And on an x-ray, again, you can see all the spongy bone, the trabeculae, the white lacy areas separated by the black areas, the marrow spaces. And then if we look at from a superior view, this is the alveolar crest of the inner dental septum. This is kind of faded, but this would be the crestal part of the inner dental septum. So we're just looking at this right here from a superior view. And you can see it separates these tooth sockets. This tooth socket here from this one from this one. It's bone in between adjacent teeth. This is just a microscopic slide. Again, you can see in between the close-up here, you can see all this spongy bone with the marrow spaces. And then this is just the alveolar bone proper of this tooth socket and the alveolar bone proper of the, oops, I'm a little outside of it, of that tooth socket. Okay. Okay, the clinical application I just want to show you is that you're actually going to be looking at the position and contour of this alveolar crest in the inner dental septum. So we're going to come back to that, but I just wanted you to understand why, an awareness of these areas is so critical. Okay, a final area that pertains to the alveolar bone is the interradicular septum. And remember, the radicular is the adjective for root, and inter is in between. So this is a section of bone, alveolar bone, that's located between the roots of a multi-rooted tooth. So all of this in here is the interradicular septum. So it's the alveolar bone located between the roots of a multi-rooted tooth. And last week we went over the principal fibers that have the same name that attach to the coronal part of that interradicular septum, right in this area, in that bifurcation, trifurcation area. Okay, just like the interdental septum, there's actually, we can see the spongy bone shown in this diagram. And then on the mesial and distal boundaries, I can see the alveolar bone proper again. So on the distal part of the mesial root and the mesial part of the distal root, it's the alveolar bone proper forms the boundaries of the interradicular septum. And then not shown is the compact bone that would be covering on the buccal and lingual, just like it does for the interdental septum. So I can really only see the interradicular septum if I have the compact bone cut away. So you can see right in here, here's an interradicular septum for this tooth and the interradicular septum for this tooth. Notice again, it's spongy bone. Here you can see these trabeculi, huge marrow spaces. And again, on the mesial and the distal, it's lined by the alveolar bone proper there, right in there. If I look from a superior view, here is I'm just going to change back to the same color. Where the two tooth roots would fit on either side of this, and right here from a superior view, I can see the interradicular septum.
Ms. Myers, what was that last bullet? It said compact bone.
Yeah, it says that it's on the outside, like when you look at this picture on the left-hand side, see how like up here, the compact bone was not cut away, but so it's really covered. The interradicular septum is made up of compact bone on the buccal. It was just cut away right here to expose the area. And then let me just try to, okay, so here's the interradicular septum. So one tooth root would fit in here and one tooth root would fit in here. And then this is just that interradicular septum with the green line. So here we're looking at it face on, mesial distal view, and this is from an occlusal view. But just going back to this, it's just, it's the same as the inner dental septum, that it's spongy bone lined mesial distally by alveolar bone proper, shown in blue, and then not shown, it's covered by compact bone. So if I went back to this picture, the interradicular septum is right in this area. I just can't see it because on the buccal, it's made up of compact bone. But when the jaw's cut away, I can see it. When the compact bone's cut away, I can see the interradicular bone there. Okay, so what about on an X-ray? You can see the arrow is pointing. Here's that interradicular septum area on this molar. And you can see the spongy bone. And then forming the mesial boundary is the alveolar bone proper. We can see that lamina dura on the X-ray. So not only are you going to be looking for radiographic bone loss in the interdental septum area, you can see here's an interdental septum. This area, you're also going to be looking at the interradicular area. And I just wanted to, if you look at these two molars, there's been no bone loss in that interradicular septum. But if on the radiograph on the right, if you look here, you can see there's been bone loss right in there. And that's actually referred to as furcation involvement. Have you started talking about periocharting yet in fundamentals?
I think we did.
A little bit, like I just didn't know if you were like shown how the right symbols for furcation involvement on a perio chart. That's something that you're looking at clinically as well as radiographically to record on your periodontal charts. So the left shows like no bone loss in the interradicular septal area, and on the right it does show bone loss in the furcation area. It also shows there's been an extraction here. That's why this interdental septum is so wide there. There's also been bone loss in here too. And in here, we'll talk about that momentarily, like right in there. Okay, so those are the landmarks: alveolar process versus basal bone, all the sections of the alveolar bone from alveolar bone proper to spongy supporting alveolar bone to compact supporting alveolar bone. And then the specific areas, the alveolar crest, interdental septum, and interradicular septum. I'm going to have us do that in lab, but let's move on to where it says the external contour of